First, we are going to discuss the history of the Dominican healthcare system and factors which have influenced its development. This is illustrated in the timelines we have provided. A large factor in the early development of healthcare in the Dominican was colonization, which included many foreign authorities imposing their health systems onto the Dominican over the years. Colonization began with the government of Spain in the early 1500s. At this time, the Roman Catholic Church began its extensive role in the development of the local healthcare system. The Church provided university training, hospitals, and medical professionals. The first healthcare laws were passed in the 16 and 1700s. These laws ordered training and licensing of midwives and doctors. They also created sanitary commissions, which were the beginning of public health initiatives in the Dominican. Some shortcomings of the Spanish government included failure to provide educated doctors to train upcoming medical professionals, and failure to produce an adequate number of trained doctors to meet the healthcare needs of settlers at this time. Both of these shortcomings negatively impacted the development of the healthcare system in the Dominican. The next major event in the history of the healthcare system was the signing of the Treaty of Basel, which signaled the beginning of French rule in 1795. The French rule impaired the progress of the health system of the Dominican. The French government removed all public health laws, policies, and institutions, making the medical profession free and unregulated for anyone to practice. The development of healthcare was halted during French rule, and this continued when the government of Haiti gained control of the Dominican in 1822. This government closed the health institutions and councils which had reopened after French rule had ended. Next, in 1916, the U.S. military took over control of the Dominican. Some argue that the U.S. military presence was the largest historical influence on the Dominican healthcare system. This military presence occurred between 1916 and 1924. During this time, they began to mold the Dominican healthcare system into one which was based on a Western biomedical model. This healthcare model was expensive, technology and physician dependent, curative, and urban-based. It did not meet the unique needs of the Dominican population, especially those living in poverty and rural settings. There was complete removal of the cultural aspects of healthcare, which Dominican people had relied on for many years. This included indigenous healers, folk medicine, and midwives. The departure of the U.S. military in 1924 left Dominican population with healthcare system they could not run on their own. The U.S. had not trained local residents in new healthcare positions and had removed all funding, leaving a lack of expertise and money. In 1978, the Dominican Republic gained independence. As a result, healthcare reforms began to occur. They adopted the current Westminster model of government, which is centrally administered with a parliamentary-type democracy. They gave authority for health policy development to the Minister for Health, who defines these policies with advice of the Permanent Secretary and Chief Medical Officer. They also formed a Management Advisory Committee, which meets quarterly to consider policy issues and to advise the Minister for Health. In 1982, additional health sector reforms occurred. The primary healthcare approach was first initiated at this time, and the government implemented an approach which involved decentralization, deconcentration of services, and extension of coverage. Next, in 1996, the amendment of the Rousseau Hospital Act was implemented. This amendment introduced the new user fee system. Next, the Environmental Health Services Act, No. 8, was passed in 1997. It provided legal basis for pollution control and waste management in the Dominican, and the jurisdiction to make regulations with regard to food safety. Next, the General Health Law 4201 was passed in 2001. This law separated the functions of care delivery, leadership, and financing. Also in 2001, Law 8701 was passed, founding the Dominican Social Security System and setting up methods and sources for the funding of medical care in the national health system. 3 financing methods were also established: contributory, subsidized, and contributory subsidized. In 2009, management agreements between the regional health services also occurred. They established commitments and obligations which were to guide the treatment provided by regional health services.